Hello and welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Extended lymph node removal not beneficial for patients with clinically localized muscle-invasive bladder cancer. An extended lymphadenectomy, that is removal of additional lymph nodes beyond the extent of the standard procedure in patients undergoing radical cystectomy or removal of bladder and nearby tissues, because of clinically localized muscle-invasive bladder cancer, provides no patient benefit as measured by disease-free survival or overall survival times. It does, however, increase the risk of adverse events, which are side effects and post-surgical death. Once cancer invades the muscle of the bladder, it can also get into the blood and lymphatic system and can lodge in the lymph nodes. In about 1/4 of patients with muscle-invasive bladder cancer, the disease has already spread to regional lymph nodes. For this reason, after removing the bladder in these patients, surgeons will also remove all of the lymph nodes in the primary landing zone from around the bladder. Removing those lymph nodes, known as lymphadenectomy, significantly reduces the chances of the cancer returning within the pelvis. The SWOG S1011 trial asked whether it was better to extend the lymphadenectomy to remove even more lymph nodes from a wider area and whether this would reduce the risk of recurrent disease or death. Lung infection could be less transmissible than thought. Recent research found that various strains of the bacterium Mycobacterium abscessus were genetically similar, stoking fears that it was spreading from person to person. But a new study by Harvard Medical School researchers published May 22nd in PNAS journal calls those findings into question, offering an alternative explanation behind the genetic similarity of clinical clusters. This suggests that the pathogen may not be that prone to person transmission after all. The team set out to investigate a hypothesis that the samples appeared genetically similar because the pathogen was evolving at a very slow rate. The scientists first used a large data set of M. abscessus genomes to create a tree of life, a kind of genetic family tree for the bacterium. They looked at branches of the tree with clusters of genetically similar strains, then tried to calculate their evolutionary rate. They found that these genetically similar clusters were evolving around 10 times more slowly than typical M. abscessus strains. Ketamine nasal spray for refractory migraine may prove safe and effective. Ketamine taken in the form of a nasal spray may prove a safe and effective treatment for refractory chronic migraine, suggests a single-center study published in the open access journal Regional Anesthesia and Pain Medicine. The researchers retrospectively reviewed the outcomes and experiences of people given nasal ketamine spray for chronic refractory migraine between January and February 2020 at one single specialist headache center. During this period, 242 people were prescribed a nasal ketamine spray, 169 of whom agreed to be interviewed. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.